So hi everybody, I'm happy to be with you, and I'm the booth of International Academy of Clinical Hematology. As you see, this is the second year at EHA that we have an official booth and an office. And the other thing you will know that I'm with no jacket and tie for the first time in my life because it's very hot here, so I apologize. So I would like to just mention the highlights of transplantation at EHA. You know, EHA is a hematology meeting, and a lot is going on in every aspect of hematology. There are 10,000 people here, the best meeting in Europe, but transplant is here to stay. And in all the session about myeloid malignancies, with the immunotherapy, with the CAR T cells, with the bispecific antibodies, still the transplant is the only way to cure people that can tolerate transplantation. And we heard here a lot of talks about how to reduce the toxicity of the transplant because, you know, obviously the allogeneic effect, the graft versus leukemia effect, is very strong. And so not just for young people to offer transplant, but also to patients, elderly patients. There was just a talk this morning on the microbiota with the CPX351. You know, with the CPX351, less toxicity, but interesting. They're also keeping the microbiome, and patients that after CPX351 go to transplant has less GVHD and less mortality and less infections. And so for secondary AML, which is about unmet disease, there is a lot of progress. I mean, what is the optimal graft, bone marrow, peripheral blood, the PTCY in secondary AML, then the mutation that defined, and we also have the new drugs like I mentioned before. The same is true for myelofibrosis and for MDS. So a lot of new drugs in these diseases, but still cure is only by transplantation, and we know that the breakthrough of haploidentical transplant and the post-transplant cyclophosphamide is here. We are reducing the dose of the PTCY, more and more studies. We have new drugs coming in for GVHD prophylaxis, putting ruxolitinib and other new approved drugs up front. Some data from China again about blocking again the humanized IL-2 receptor antibody and so on. So in spite of the fact that this is not a BMT meeting but a transplant meeting, still transplant is a very important tool to cure patients, and if we were able to reduce toxicity, it will flourish. And the other issue is the CAR T cell, cellular therapy, and the CAR T cell are moving to other indications, not yet so much to myeloid malignancies, but to autoimmunity. So we started with transplant in autoimmunity many years ago. It did not hold because of the toxicity, but now a lot of emphasis on CAR T cell for autoimmunity, and we are looking forward to the data. It will be a nice talk today in 1 hour by Rafaela Greco and other leaders in the field. So thank you.